to.
Okay, our first situation is about a client named Patty who has been in and out of the hospital all her life due to chronic mental illness. She wants to be in the community, but when discharged, her anxiety and paranoia increase. She is unsuccessful due to wild accusations and accusations she makes about staff and peers of the group home. She is preparing for yet another trial run in the community, and her anxieties are already starting to rise. Hi Patty, my name is Samantha, and I'm going to be your nurse this afternoon.
Hi.
How are you doing this afternoon?
I'm doing alright.
Oh, good. So can you tell me a little bit about what brought you in today?
Yeah, well, in my group home, I just feel like the staff there are always just trying to hurt me, and it's really scary. So, and a lot of the residents, I feel like they're talking about me behind my back, and I don't know, I don't really feel safe there, and it makes me really anxious, and I don't know, I don't really think I feel safe all the time, so.
Okay, I can see how that could be very frightening. Do you have any support system that lives in the house with you, or maybe that you're in contact with?
Yeah, there is, well, there's one nurse there that I do kind of trust more than the others, and, you know, she doesn't always work when I'm there all the time, so I don't always have her there, but my sister, she kind of understands, so I do trust her, and I could definitely talk to her about stuff, but I just don't always get to see her because she doesn't have a car and she can't get there all the time, so, but she is probably my biggest support system.
Okay.
So.
Can you tell me a little bit about what's happened at your home?
Yeah, well, there was a time when I came home from work and I walked in the house and one of the other residents there just started yelling at me, and I have no idea why he was yelling at me, and it was really scary, and I just didn't really know what to do or where to go, and that nurse wasn't there, and I felt like all the other staff weren't really helping me either, so I was just really scared and didn't know where to go, so I just wanted to go in a room by myself and just try to feel safe. So that was just one of the times, but I just feel like they're always talking about me behind my back or just even planning stuff to hurt me. I don't know. It's really scary. So.
Have you been able to talk to this nurse about these situations?
Yeah, a little bit. She's just not always there, so she can't really do too much. But I've tried to talk to her about it, and she seems to understand.
Okay, and do you think it would be beneficial to you if we set up a meeting with that nurse and maybe the group manager at the house?
Yeah, I think that would help. Hopefully, they can do something to help me, because I don't know, it's just really scary.
Okay,
So.
well, we can work on something like that for you.
Okay.
Can you tell me a little bit more about how you take your medication at home when you're not in the hospital?
Sure. Well, I sometimes take my medication. I don't always. I just feel empty when I take it, sort of, so I just don't always do it.
Okay. So what you're saying is that you haven't been taking your medication because it makes you feel empty inside, is this correct?
Yep.
Okay. Well, let's discuss some interventions to help you get on the proper medication schedule. What we can do is to see if we can meet with your provider to change or to adjust your medication and see if we can help with those adverse effects, such as feeling empty. However, until that appointment, let's discuss how we can figure out your medication routine and make it a little bit more frequent and on a regular basis. What are your thoughts on those ideas?
Yeah, I think that sounds good. We can definitely try it, and I just don't want to feel that emptiness anymore, so
Okay.
we can get that figured out.
Okay. So Patty, can you tell me a little bit about how you used to manage your medications at home? How did you keep it on schedule?
Yeah, I used to have a calendar, and I would mark, each time I took my medication, I would mark it off, so that helped, but I don't have a calendar anymore, so I don't really know what to do now.
Yeah. Okay, well, I'll work on seeing if I can get you a calendar so we can put your medications on the days, and then when you take it, I'll have you initial it so you know you've taken it. I also think it would be a great idea for you to go to group therapy, maybe about once a week.
Okay.
It's a good way to get a support system and to meet other people who are dealing with things such as anxiety and anything that you may be feeling other people might be feeling as well.
Okay.
What are your thoughts on going to group therapy?
Yeah, I think that would help. I mean, I'll definitely give it a try too, and I would just need a ride there. I don't have a car or anything, so I can't get there myself, but.
Well, it sounds like a great start. I'll get in contact with the transportation service and see if we can get you to and from therapy every week.
Okay.
I'll also help you set up your calendar, and we can set up your medication schedule, and I'll have you practice signing off, and so you'll get the hang of that. But if you feel as though any of these interventions won't help you, please let me know. We can try and figure out something else. I'll also talk to your group home manager and see if we can set up a meeting and talk about different ways so we can get you some support at home. I'll set up an appointment with your physician and see if we can change the meds.
Okay.
But please let us know if you're having any problems with the medications, and we'll have you come back in to talk to your physician, okay?
Okay.
Do you have any other problems you want to talk about today?
Nope, I think that should be it.
Okay,
So,
thanks,
yeah.
Patty. Have a great afternoon.
Thank you. Alright, so this is our second situation. I'm going to be the nurse in this one. So Terry has a problem with insomnia and often takes sedatives combined with alcohol. She has come to the clinic today to talk to the doctor about increasing the dose of her sedatives, but instead she was referred to speak with me for problem solving for her insomnia. Hi Terry, I'm your nurse today. I'm Steph. So how are you doing today?
I'm okay. I came in today just to see if you could help me out a little bit.
Okay, can you tell me what you would need help with today?
I've been having a problem with insomnia for the past couple months. Nothing really seems to work, so I wanted to see if the doctor will increase my sedative, but he doesn't want to do that. He sent me to see you.
Oh, okay. Can you tell me a little bit about when your insomnia started?
It started about a couple months ago. I switched from having overnights at my job to AM. It was a hard transition, so I started taking a sedative, and that helped, but it didn't do anything for me, so I started drinking a glass of wine with it at night, and then that would help.
Okay. So what different things have you tried for your insomnia?
Before I got my sedative, I started a drug called melatonin.
Okay.
I would take that every night before bed. I didn't feel like that helped at all. And then I tried my sedative, and that didn't work. And then I tried taking my sedative, and then I had a glass of wine with it every night, and then that just helped me go right to sleep. So.
Okay. Alright, so what you're saying is that your sedative works better when you take it with the wine or any alcohol, is that correct?
Yes. Yep.
Okay. Well, when the alcohol and the sedative combine, it can create many health problems for your body. I'm not sure if you're aware of that. So we can just discuss some alternatives to the wine or alcohol and, try and help or have that help better. So what are your feelings about trying something new?
That'll be okay as long as I can still sleep at night, because it's really important I'm rested for my job.
Right, yeah.
So.
Okay. So here's a couple of different interventions you can try for your insomnia. So the first one would be to decrease any caffeine after 5 o'clock in the afternoon. So anything like pop, coffee, tea, anything that's going to keep you awake at night. We want to have that only before 5 p.m. So it's just going to keep you awake at night just until it gets out of your system. I think that probably could be an issue. Also, your sedative, it does take a little bit to work right when you take it. So try taking it maybe an hour before you go to bed. That might help instead of if you take it right away and then try to sleep, it's not going to kick in right away.
Okay.
So that might help. Another thing would be to decrease some environmental stimuli, which would be making sure the lights are off. It's pretty dark in the room. If there's some light, it kind of tends to create some insomnia. So also reducing background noise. So if you have the TV on or radio or something like that, just to kind of turn those down or off if you can sleep without that. Avoid taking afternoon naps if you can. I don't know if you do take naps, but if you do, just try and take them in the morning if you have to, but otherwise try avoid them if you can at all. And then another thing, if you exercise, try to do it in the morning or afternoon, kind of before 5 o'clock with caffeine. That might help, because if you are up exercising at night, then it's going to, your body's working hard, so it's going to keep working and going to be harder to fall asleep. So those are just some things you can try. How do you feel about those?
They sound good. Do you know if Diet Pop has caffeine in it?
Yes, it does.
It does.
So,
Okay.
yep.
I'll have to reduce that. I drink quite a bit of Diet Pop.
Okay.
Another thing I do is I take naps right after work. So I take
Oh.
like a 3 or 4 hour nap right after work. So
Okay. What time are you done with work?
I get done at 3.
Okay, so that's kind of pushing it a
Yeah.
little bit.
So maybe I'll try and go to the gym after work and then
Okay.
just stay up and see if that'll help.
Yeah, yep, that would definitely, if you can give it a try, and if that would help, you know, or if you absolutely need a nap, just take an hour one. Just make
Okay.
sure you're gonna get up, and you know you'll be up by 4:30
Okay.
then, and
Yeah.
that could help. So
Okay. I'll give them a try as long
Yeah.
as I can sleep.
okay,
That's what's
yeah.
important.
So I just, you know, I hope these interventions will help. It's, you know, gonna be a lot better than taking them with the alcohol. So if you can just, you know, give a few of them a shot and see what we can do, and if you feel like they aren't working or you need something else, you know, just come back in and we'll definitely try and figure out some other solutions and get this insomnia taken care of for you.
Okay.
So
Sounds great.
yeah, did you have any other questions for me?
I don't think so.
Okay.
I'm all good.
All right, well thanks for coming in.